Hello, welcome back to Two Dumbbell Blondes. I'm Lindsay.
And I'm Katie. Before we get started today, just a reminder that whatever platform you're listening on, please follow and give us 5 stars. And now that we are on YouTube, please subscribe and give us a like for the episode that you are about to listen to. So today we have JoAna Werner on. I'm going to toss it over to Lindsay to give a little bit of an introduction.
Yeah, so I actually met JoAna after I had some blood work done. I think it was about a year ago now at a place called LX Medical. And JoAna is a physician's assistant, but she works at this location that essentially helps people deep dive into their health and does the interpretation and gives recommendations after the results come through. Something I really appreciated about JoAna was I feel like in that world, sometimes you can be over-prescribed things or over-recommended things. And I think JoAna really listened to me as a person and what I was looking for and made those recommendations that truly were going to move the needle the most for me instead of making it feel like it was overwhelming. So we love having JoAna here. She is going to deep dive with us on some of the blood work that you can get done, some of the results that can come from that, and a little bit into hormones and recommendations of what we might need to look into doing. I think hormones is a buzzword for sure in the industry right now. So it's one thing to say you think you have something wrong with your hormones and another to actually know that that is the case. And then what do you do if that is the case? So JoAna, thank you for being here. We'd love to hear about how you got started into what you're doing and then go a little bit more into what you do on a day-to-day basis.
Yeah, sure. So I have been a medical provider for 13 years. I began my practice in family medicine. It was super important to me out of school to really have a firm foundation in general medicine. But I quickly learned that my vision for really helping people live a longer, healthier life was not being fulfilled in that role. I felt like I was pushing a lot of pharmaceuticals, and most of the patients I was seeing were non-compliant. They were not invested in their health. They wanted a quick fix for their condition. So I then moved to general surgery. I worked there, loved it, but it was not conducive for family life. I also don't have a great back, so standing long hours, did not appreciate that. I moved to urgent care after that, where I worked, and again, felt like I was just pushing medications. Everybody was trying to put Band-Aids on bullet holes. No one wanted to hear that they didn't need an antibiotic for their upper respiratory tract infection. And the second I started talking about gut health, their eyes just glazed over. So I then had the wonderful opportunity to join LX Medical, a health and concierge wellness practice that I work for now. And that's where I joined the Academy of Anti-Aging and Longevity and really took a deep dive into hormone health, supplements, peptides, regenerative medicine. So I finally kind of feel like I can practice medicine the way I want to. I feel like I can really take care of the whole patient. I have enough time for patients. We do this comprehensive lab work that really, allows us to look under the hood and see what exactly is going on that we can be proactive about and not just waiting for these disease processes to occur that then we have to throw all these medications on that have, all these risks and bad things that can happen with them. So I finally feel fulfilled in the role of being a healthcare provider, really able to help people live longer, healthier lives.
Yeah, and I would say most people that listen to this are probably more in that category of being preventative, or they're trying to be more preventative, and they're more open to some of these recommendations to get ahead of it. So if we have listeners right now and they're sitting here and they've maybe never done blood work, or maybe they've only done blood work in like a normal, like physician, like your basic panel. Your basic panels. How would I know, or what would be an indicator for me to maybe dive a little bit deeper and maybe get a little bit more done as far as like what you guys offer?
Yeah, so I really think, anyone over the age of 20, I think it's a good idea to do one of these comprehensive panels because there's just so much more information that goes into them, hormone levels, cortisol, micronutrient deficiencies. And in traditional medicine, we do all this blood work. If it's in the normal range, we say, oh, you're good, see you in a year. Versus really, if it's on the low end, the high end, there's certain kind of fine tunings that we can do before it becomes an issue, which is important. And I don't mean to hate on traditional medicine, but they're seeing so many patients that they just don't have the time to really get into that. And medicine is So you have your family medicine providers, your internists, but a lot of it is so compartmentalized, meaning you have something wrong with your GI tract, I'm going to send you to GI. You have something wrong with your joints, I'm going to send you to rheumatology. And it's like, well, let's look at the base of what's going on. You know, if there's gut issues, you send them to derm, they're going to want to fix what's on the outside. And some are starting to go deeper, but I just think that there is a place for figuring out underlying deficits that will fix more than one issue in a person.
And I think that we need to state and note that when you go into medicine, you do specialize and you do become an expert in one thing. So if you are an expert in this, you may not, my uncle's a physician and we had a lot of conversations about this. Like, you don't really understand the correlations of all the things that are coming through on these panels. Like, this may say that this one is good or in the normal range, but in relation, or when, you know, two things are working together, and I'm speaking in a very uneducated manner because I am not a specialist, but this is something that you work with every single day. You've studied it, you understand it on a deeper level than I would argue some of the other doctors that specialize in oncology, or, you know, everyone has their specialty. Doctors just don't mean that they know everything, because they don't. That is why there are specialists. So
right.
when you do talk about a comprehensive panel, this question is asked to me a lot. What does that entail? How much does it cost? How much blood is going to be taken? You know, all the things that people think about, like, okay, well, yeah, I get blood work, but when I do that, what is it? What additionally does that mean?
Right. So if you're a member at LX, this membership includes getting comprehensive blood work twice a year. It's included, so there's no additional cost, which is awesome. Okay. If you're not a member and you just want to come in and have it done, we have two different panels, a smaller panel, which is still, you know, 80 biomarkers, and that's $499. The more comprehensive one, which is over 100 biomarkers, is $799. And you still can do the blood work and get that hour-long consult without necessarily being a member. I think the key to being a member is that things change. So we might start you on certain supplements, and especially if you're doing hormones, we will likely repeat those in 3 months. And so having, you know, being a member, you just have better coordination with what's going on and changes, because sometimes you have to tweak things. So what can be wrong now and 6 months from now might not be the same supplements or recommendations that you need. So having someone that's going to follow you along this journey and kind of tweak things where they need to be tweaked is really important.
So you mentioned a couple things, you know, that you wouldn't get at your general physician versus when you could do a comprehensive panel. You talked about some of the micronutrients, some of the hormones. Like, if I'm sitting here saying, what do I get with you that I wouldn't get at my regular doctor? What are those things? And then to your point earlier too, a lot of times they're just going to talk to you about things that are treatable versus not being optimal. So talk about, like, what are the things that are different? And then how do you look at them differently as far as like what the numbers provide you?
Sure. Yeah. So there's hormones included, male and female. There's thyroid, B12, vitamin D, your regular CBC, CMP, which is kind of looking at overall organs, your cholesterol, apolipoproteins, which there are some providers that are starting to test those more. It kind of takes a deeper dive into cholesterol, because you can have high or low cholesterol and not be at risk of cardiovascular disease. But if you have some of these genetic predispositions with your cardiovascular panel, you are at higher risk, meaning if your cholesterol is high and you are at a higher risk of forming plaque and having a heart attack, I'm going to be a lot more, I'm going to try to be aggressive in lowering that with certain supplements or medications. And maybe you do need a statin, maybe you need Repatha, those kind of hard hitter medications, versus you could have higher cholesterol, but you're super low risk. You have no plaques. You have nothing on your CT cardiac coronary score. I'm not going to be as in tune to trying to fix that. So there's just a couple more markers that help us delineate who's at high risk overall and who's not. I'm trying to think what else is on the lab report. Cortisol, that's another big one that's important to look at. And then we do have add-on tests. So if someone is interested in looking more into like their gut health, there's certain panels that we can add on to that. We look at homocysteine. I should have had my sheet right in front of me. But yeah, and then there's other things like looking at sleep. We can order certain sleep studies that can be done right in your home. We can order certain genetic tests to look at if
Wow.
you're genetically predisposed for certain things. We have a Gallery test that looks more at cancer. And we also just partnered with Prenuvo, which is a full body MRI scan. So that's also kind of fun to do. I actually did it, and it's super comprehensive and interesting to look at everything.
Interesting. So if, I'm having symptoms, I'm having things that are coming up for me, what are some of the common ones that you see with people coming in that maybe they thought could be fixed before looking deeper, like looking under the hood? Like, what are some of those common ones you see people come in for that, like, I was experiencing this and this was the result after I had my lab work?
I would say the biggest thing we have people coming in for is weight loss. And there are some people who, just Googled GLP agonist, semaglutide, tirzepatide, was started on one, and is like, I'm not losing weight. All my friends are losing weight. I'm not losing weight. But without really getting into their underlying metabolic issues, there are some things the GLP might not be the best option for you, or you might not know that you have such a high cortisol that you need to work on that first before your body's even going to really allow you to lose the weight. And once we figure out, helping your adrenals or your thyroid, those weight loss medications are not going to be beneficial. So really looking at those key underlying metabolic issues. And then the other thing is people will be on the GLPs. They might lose a whole bunch of weight, but the second they stop them, if they have not addressed those issues, they're going to gain the weight right back.
Mm-hmm. And to that point, I don't really remember when I had my appointment, and I know it's obviously different because I'm a trainer and nutrition coach, but if someone comes in and they're not a trainer and nutrition coach, do you guys partner with people that do help them, beyond here we're recommending this supplementation or this hormone that you be on, like someone that's helping them with the habit and behavior changes?
Yes. So we have an awesome dietitian, Alex Shep, who will meet with people. We always recommend they meet. You can't make someone do something they don't want to do, but especially anytime they're starting on a GLP, because it's so important to have that high protein, and you're not going to be as hungry when you're on these medications. So yeah, it's easy to be like, well, I'm just not going to eat, but you're going to feel like crap. You're going to lose muscle. That's not a good way to lose weight. So that's super important. But then also, yes, the fitness component. So we also partner with KJ Fit, but if someone's going to the gym, I'll certainly give them some tips. But if people really want the hands-on trainer, we do have someone that we can recommend. But that's another key component, is not losing muscle. And so many women are like, yeah, I exercise all the time. I walk 5 miles a day, which walking's great. Cardiovascular is so important, but resistance training is really going to be what helps women, especially as they get older, so that you don't break a hip and all those things that are going to be increased risk for mortality for you. So,
So there's two specific questions I want to ask. So I want to talk a little bit about hormones, and I also want to talk about peptides, and there's some crossover, but let's talk first about getting blood work done to check hormones, and why someone would do a panel like this versus doing it with their doctor. And then based off of what you see with from the blood work, what are the different paths that you take with people? And I'm sure that specifically talking about women, like obviously someone in their 30s is going to be different than someone in their mid to late 40s, 50s, 60s. So can you talk a little bit about that?
Yeah. So even if you're in your 20s and 30s, again, I still think it's good to get kind of that baseline comprehensive blood work done, because you don't know what you don't know. As women age, sometimes we have to check hormones differently. So starting with the serum testing, blood test is a perfectly fine place to start. Once people are taking hormones, then I tend to check them in either saliva or doing a Dutch test, which is a dried urine test for comprehensive hormones. It does get a little deeper into different metabolites as well as organic acids, free cortisol. So I do really like that test once people are on hormones, or even in younger females. Sometimes it's helpful to do that as well. And then based off of that lab work, let's say you're in your 20s or 30s and you have really heavy menstrual periods, or you're having PMS, your progesterone's low, we can certainly supplement that to help with those things. If you are in your 20s and 30s and you are not complaining of any issues, I tend not to really touch hormones. If it's not broken, don't fix it. But as we get into perimenopause, menopause, even if you're not having symptoms, there is definitely protective benefits of starting hormone therapy earlier versus later. If you start it within 10 years of menopause, it's more cardioprotective, bone health, brain health. There is a point, a window of opportunity that if we miss it, it is not as protective and in fact can be detrimental in certain populations who are high risk for cardiovascular disease. They already have plaque formation. We could probably do a whole talk on that, but I don't even remember your beginning question.
Just that. I mean, hormones is so bad, and there's so much we could talk about with hormones. But I'm 44, so for sure perimenopause is something that I'm thinking about, and just having those tests and knowing where. So let me ask, why would I do a test like this versus going to my primary?
I think in general, well, one, you have to find a person who is willing to even prescribe hormones. So let's say you're seeing your normal primary doctor and they're like, doesn't matter what your labs show, I'm not giving you hormone therapy. Well, there's no point in checking anything with that person. If you ask them to specifically do all these tests, you bring it in there, you have them all written down. Some of them will say, okay, sure, I'll do it. Hormone or insurance probably won't cover it. Some of them would look at that and be like, I'm not going to do anything with this information, so why would I do all these tests? For the most part, providers will check, cholesterol, CBC, CMP, thyroid, even hormones. Not a lot of them will go deeper than that. You can certainly ask your care provider, but it just kind of depends on what they feel comfortable with.
Okay.
So from lab interpretations that you do, because it's not always people that are in this stage of life that you're talking about, what do you feel like are some of the low-hanging fruit for people that really it doesn't need a prescription, it doesn't need anything in addition to, it's just like they need to address lifestyle and habit changes? What would you say are some of the common, like, hey, we need to really just focus on this and see where this can get us?
Yeah, I definitely, well, for all patients, the three foundation for me are sleep, diet, and exercise. So no matter where you're at, even if you feel good, that's important. If you don't feel good, and people who, these supplements and these therapies, they're not cheap. So if it's like, I don't have a lot of money, I want to feel better, what can I do? It's always make sure you're sleeping good. Don't be looking at your phone 10 minutes before you're trying to sleep, dim the lights, managing your stress, because some people say, well, I have a great bedtime routine, but I cannot sleep. And it's like, well, if my cortisol is sky high all day long, I am stressed. The second you try to relax, it doesn't matter. So working on that foundation of, do I need to do some box breathing? Do I need to meditate? Do I need to exercise? And then again, diet. If you're not giving your body what it needs, it's not going to perform. With the regenerative medicine space, I'm a proponent that your body can do a lot of things if you give it the component that it needs. So focusing on that and good nutrition. And again, we could get into all the bad things in our food that even if you're thinking you're eating healthy, there's certain things in food that people don't even realize that are endocrine disruptors and all these things. So trying to eat clean, sleep, move your body, resistance training, I think those are kind of the foundations. And, beyond that, there's, of course, good supplements that most people need, even if they don't have blood work, magnesium, vitamin D, B vitamins. And most of those you can find for cheap on Amazon. I always recommend going through like Full Scripts or something that's a little bit better quality. But if you did a whole bunch of blood work, everything's completely normal, but they're feeling tired or those kind of things. Again, looking at the foundations, and then probably just those key kind of micronutrient things that everybody needs and benefits from.
It's interesting because you're hitting on the basics, right? The foundational things that we preach all the time. But I do think there is something to when people see it on paper that it can reinforce that they need to change stuff versus just being told. So you mentioned supplements, and you said you can find them pretty inexpensive online. Now, Katie and I, and what we do, like we work for a company that sells supplements. So when someone is looking to get a magnesium or a vitamin D or whatever it is, what should they look for? Because there's definitely differences out there. And you said Full Script is probably better because they filter through what they list on there. But what should I look for in a supplement, regardless of what it is?
There is definitely a good, better, best when it comes to supplements for our listeners.
Yeah.
They're all not created equal.
Right. Well, and especially like with magnesium, well, there's so many different types of magnesium that people can just buy a magnesium, and really it's all magnesium citrate. And if you take too much of that, we know what's going to happen. You're going to get diarrhea, versus finding one that has like the glycinate, the L-threonate, that kind of thing. And even, there's one I won't say, but one that I really liked, and I finally took a deep dive into it, and it was mainly magnesium oxide, which is actually not as beneficial as some of the other ones. So even you might be thinking you're taking a good supplement, and then you really look into it, or it's a proprietary blend and then you don't know exactly how much of each. So trying to find one where it actually lists the amount of each of them. As for vitamin D.
So just hold on. I'm going to hold.
Yeah.
So magnesium, what type of magnesium should people be looking for?
I really like, there's one by Orthomolecular that is, I can't remember. It's their magnesium blend, but it has the glycinate, the L-threonate, and malate, I believe.
Okay.
Those are kind of the three that I like.
I know the L-threonate is the one that breaks the blood-brain barrier. It's the only one that's more for like the mental. Yeah.
Yep. So it helps with concentration, sleep. But you can take it earlier in the day. It won't make you tired, but it helps with sleep. I don't exactly know how that works, but I started taking it, and I don't know. I think I'm thinking clear, maybe.
Nice. You've made sense so far today, so I think
good.
It's working.
Yeah. And then what you were going to talk about vitamin D?
Yeah, so I like vitamin D with K2. Just helps with absorption. The one thing you have to be careful with is if you're on a blood thinner with the K. But if people are coming in and they've been on a vitamin D supplement and it's still low, well, one, either they're not taking enough, or I'll do one with the K2 just to help try to boost it.
Mm-hmm. And vitamin D as we go into the winter months is even more important. So listeners, if you're living in the frozen tundra like we are, or anywhere where it gets, you don't have as much sun exposure. Go ahead.
Right. Too is, if you're in our office, your vitamin D is low, we do have vitamin D injections. So a lot of times I'll just be like, hey, let's boost you up with 50,000 right now, still take the oral supplement, but at least we know that that's getting right into your bloodstream versus, the oral, everything orally doesn't absorb as well versus through like an IV and stuff. So, but yes, very important with.
And I think that goes back to your like micronutrients and your gut health and all of that. Like and I know that I'm, personal victim, I guess you could say, of this, but like what you're putting in your mouth isn't always what your body is breaking down and digesting and absorbing. So I think that is, another path we could go down of when you work with people for gut health, and what are common things you see and how to help those.
Yeah. So gut health is so important. And as for, what could be on your blood work, sometimes it's as simple as like your eosinophils, your basophils, monocytes, those kind of things are elevated, just showing that you're having kind of an increase in allergies. And along with gut health, I think it's good to, one, figure out if you have any specific food allergens, because that could be affecting your gut. And two, looking at potentially signs of like SIBO or leaky gut, things that are really detrimental and need to be addressed. Because even if we put you on the best fiber, the best probiotics, if you have an overgrowth of bacteria, it's not necessarily going to be beneficial. But I think there's more and more studies on how important gut health is for, you hear about like mental health and stuff, but even your immune system, 70% of your immune system comes from the gut. So I'll see even parents with little kids that their kids are getting sick all the time. And they're like, I give them all these vitamins, they get good sleep. But you look into what they're feeding them, or, their stress level, and it's just wreaking havoc on their gut. But parents don't really think about that. Or even in adults, women who have acne can sometimes have horrible gut health. So we could keep putting you on antibiotics to get rid of your acne, which is in turn creating more of a gut problem. So, chicken and the egg, it kind of goes round and round that we need to address those underlying things to in turn, create you so that your skin looks better, you feel better, you sleep better, all those things.
So interesting story with that. When I was in college, so this was like 2008, I had acne, and it was like the nodules. So like they weren't like little like ones you could pop. They were like hard and along my chin line. And I went to a dermatologist, and at that time they were like, oh no, it's not anything to do with the food that you're eating. It's this, it's that, it's the other. So we tried everything. Nothing was working. Ended up going on Accutane, which if you know anything about that, it is so harsh on your body. Like looking back now, I would not do it again. The Accutane worked, yes. But then after I started getting a little bit coming back, and then I soon did a food sensitivity test and kind of eliminated a few of these things, and my skin was 10 times better. So it's just crazy as things have progressed, and like your skin is the last organ to get what you're putting in your body. So it can and will get affected if there's things that, to your point, are causing these symptoms, and they show up in different ways. So like not all food sensitivity reactions show up the same way, but for me it was that. Like, and now I correlate, I know this and that food will result in that. So it's just interesting. Like we think it's the hormones, right? But like also what else is going on?
Right. Well, and then a lot of young women are on oral contraceptives or doing like the Depo shots and stuff and having acne issues, which is horrible. And I mean, I'm all for doing whatever you can to not get pregnant until you want to, but also there could be better ways. And, of course, using condoms, which is also preventing STDs, is always a great way, but just those other things that you don't think about that could be affecting your skin and all these other things.
Your whole body.
Right.
So I want to go back and ask you and pick your brain a little bit about peptides, because I have a lot of clients who've been asking me just what are peptides? Why I have friends that are doing them or started taking them. And so can we talk a little bit about peptides and when you decide when they might be right for your clients? So first off, what are peptides and why?
Yeah, so peptides are a chain of amino acid. I think the easiest thing for people to kind of get their head around is insulin. It's probably a peptide that's been around the longest, but essentially diabetics who inject themselves with insulin, that is a peptide. So now we have so many different kinds of peptides. I think the other big ones are the GLP agonists, so semaglutide, tirzepatide, that are used for weight loss. We also have things that can help with essentially healing. So BPC 157, that's another big one. It's really good for healing the gut, but also people are on it who are training a lot and need kind of faster recovery from joints, muscle. You can also inject it right into like a tendon if you have tendonitis. So I really like that one. We also have a liposomal oral form that people will take just kind of every day. Other big ones are like thymogen, thymulosin, which are helping your immune system. So, we have a lot of people who have like rheumatoid arthritis or autoimmune stuff that can take these to kind of help boost your immune system. And the other big thing I think with peptides, with the GLPs, there are some side effects, meaning people, if you take too much, you feel nauseous and vomiting, that kind of thing. But for most of them, there's really no side effects other than sometimes people will get like a skin reaction. But you think about people who have autoimmune issues and they go to their rheumatologist and they're like, here, let's put you on these immune modulators and all these medications that can have all these side effects. My thought is, why wouldn't you start, if you have access and the funds available, to try these peptides that can potentially help with your joint pain and not have those risk side effects? Why wouldn't you try that first? And then you can always have that option to do those or even do both. But I just think the peptide regenerative medicine space is so interesting from that standpoint. And they're just finding more and more. I mean, again, we could do a whole podcast on peptides. There's so many out there.
I'm so fascinated by them. So thank you for that. Go ahead, Lynn.
Peptides are naturally occurring, right? And it's just you're just doing like a higher therapeutic dose for whatever the symptom that you're treating is.
Right.
Yeah.
So all these things are like naturally occurring in the body, but they're just essentially made in a lab, and we're injecting them at a higher dose.
And if you said if you have the means, like, why wouldn't you start there? So just give us a ballpark. Like, what is the range of what various peptides could cost somebody?
Yeah, so the GLPs, if you are getting high quality, now don't get me wrong, you could probably find it on the internet, and a lot of these bottles say like not for human consumption. You could find them for probably $200, that would last you a month or two. The ones we specifically prescribe are, I believe, like 800, 900. And it also depends on what dose you're on. So when you start, you're on a smaller dose, so it's going to last you longer. So that might last you 3 months versus if you're taking, a full syringe every week, it's not going to last as long. And then there's the BPC, the vials, which gives you about 10 doses, is, I believe, $230. And I'm trying to think what other ones. Thymogen, I think, is around the same, like $200. So
you said something about finding stuff online. I just saw this yesterday for it's a dietitian's account, but she talked about how I think Kourtney Kardashian just came out with something that is supposed to be like GLP-1. And if you actually look at what it's providing you, you essentially get the same amount produced in your body after you eat protein. So it's kind of like these people are trying to hop on this bandwagon of GLP-1s and what they can do for you. But like the dose does matter, and how it's being delivered matters, because you're throwing money away if you're buying this supplement versus just eating a chicken breast.
Right, exactly. Yeah, and there are a lot more kind of oral supplements coming out that are supposed to mimic like the GLP and that kind of thing. And yeah, that's a good point, is you need to kind of be
aware. Let me ask you a question. Like, there are websites like Peptide Sciences and places that are not like maybe a step above what Lindsay was talking about, where you can direct order. Like, it's like direct mail. What would be the difference? And they do say not for human consumption, because I think that is they have to say that. But why come to you versus doing something like that?
Yeah, so we get our peptides from Pharmakeo and Wells, which are pharmacies who, they test every batch. They test it at the beginning, and then they test it, in like 3 months, that kind of thing. So making sure that the purity is good, that it's lasting a long time, and that there isn't any issues with it, versus some pharmacies, they test it once or not at all and send it out there. And again, like I said, there's a lot out there that you can find that say like not for human consumption or whatever. And you don't really know what's truly in them. Same thing with like stem cell exosomes. There's all these things popping up, and you have no idea where it's coming from.
It's the good, better, best, just like supplements. Many are not tested, and you're just not quite sure. The ones that are a little bit more expensive have been tested. You know exactly what you are getting and what you are paying for.
Right. Well, and that's why I like using Full Scripts versus Amazon, because now you hear all about like people manufacturing things and just putting a label on it, and it might look like one that you're normally used to or from a good
That's
place.
Scary.
And it is, yeah. And you have no idea. We just assume that someone else is making sure this is okay for us, and it's not.
So I know within like what we deal with like protein, creatine, multivitamins, whatever, there can be like NSF stamps or GMP stamps on products that say they're third party tested. They've gone through the rigmarole of, yes, it is what it says that it is. It's gone through this process. With the things that you're talking about, does that also apply, or do they have like a different, I guess, body that would come in and test that and stamp that?
Yes. So the third party testing, yes, that's what they have as well.
Okay. But is it like, does it say NSF? Does it say GMP? Is it the same, or is it different? Like what they might look for on the labels?
That is a great question. I don't know, because we use those standard pharmacies that have all that kind of checks and balances. Okay. We don't necessarily have to be worried about that as much.
Moral of the story is don't buy it off of Amazon or some just like
or Target,
because these are things that you're injecting into your body, not something, I don't know.
Yeah.
Right.
So what would be, out of LX Medical is in Minnesota, based out of Minnesota? Or is it based out of, okay. Are there LX Medicals around the country, or if someone, because we have listeners from all over the world, actually, what would be their first step in
Yes.
wanting to get their blood work?
Right. So LX Medical is based in Edina, and that's where we have our office. But we have members that live all over the country. A lot of people will be members, and we do telemeds for them, or they have a home here, they have a home somewhere else, and we can ship their medicine to wherever they need to. So that's not a problem. You know, if you are someone who's just starting out and you want even just a consult, I think we can certainly see you. There's also, we do a lot of our lab testing through Quest, and there's Quest offices all over the country. So people can go and do their lab work. We get it, we can see it and run through things. We don't necessarily have to see you in person. Now, if that's not an option, I mean, there are a lot of these clinics and places. I think like Thorne does blood work and that kind of thing. So it is not difficult to find something that works for you to do the blood work. The thing I like about LX Medical is if you're local, it's really nice to see people in person. You know, we also, you know, can do an exam and just seeing how people look and respond, as well as get you the medications and supplements that are at our office. But I won't let that be a hindrance, that if you need to do it through somewhere else and just have that telemedicine, I think that's a better place to start than doing nothing, of course.
Yeah. So JoAna, how could someone get in contact with you or book an appointment, let's like at LX Medical, or if they wanted to ask you a specific question, what's the best way for them to reach you?
Yeah, so you can look us up at lxmedical.com or on Instagram, LX Medical. Those are probably the best ways. If you want my phone number, I can give you that too.
maybe not on the podcast. Eventually, yeah.
Yeah.
Oh, so I have a question, and I think a lot of times people come to blood work either because they've tried it all and then they kind of are like, nothing's working, I need to do this, or they hear a story about somebody that had success, like, oh, I did this and this was the result and this is the success I had. Can you share, I know there's, you know, HIPAA and you can't name names and all of that, but can you share a success story that you've had since you've been at LX Medical with someone that came in, this was the situation, this is what you did with them, and then this is where they got to with it?
Sure. Yeah. So I had one lady, she was having a lot of joint pain, did need to do some weight loss, was also training for triathlon. And so we started her on a GLP, did some supplements. And not only did it help with weight loss, but it also helped with the joint pain from like the anti-inflammatory standpoint. So she was able to do that triathlon, and was just, you know, so proud of herself for being able to do that. And it also sounds like has like a family history of maybe some disease processes that she's trying to avoid. So that was one of the big ones. I mean, we have so many people that have, you know, lost 40, 50 pounds and feel really good about themselves. But I feel like the weight loss and the decrease in pain and joint inflammation, those are probably the biggest things that I see that people are so happy about. And then, of course, women who are older that we put on hormone replacement, you know, one, they didn't realize that they needed these just because there's all this stigma around hormones. So educating people on that. But two, just feeling like, oh, I've gone through menopause. This is the way my life is. I'm not going to have a sex drive. I'm not going to be motivated. And then getting on these hormones and just feeling like I can still feel alive, like to live the rest of my life kind of thing. So those are the ones that I think make me feel the best, is knowing that I'm helping women, especially by putting them on something that it's not crazy to want to replenish your hormones that you've had since you were 20 years old, you know, and doing that where there's not a lot of risk profile to it.
I think that there's a stigma, and I think that it's becoming less, but there's such a stigma around hormone replacement or peptides or doing something to make yourself feel better, or to help you recover faster. What you were talking about, the BBC 157. And I think it's important for our listeners to understand that it's not dangerous. There's been a lot of research behind this. It's not bad. You are not weak. These things can allow you to live a more fulfilling life. And, if we're lucky, we get 80 years, we get 90 years, but some of us get 60 years, 50 years. You have no idea. So why not feel the best and perform the best and live to the fullest for the days that we have left on this earth? And if it's something that you're like, yeah, I would never do this, I just encourage you to just take a minute and do some more research, because it's not a bad thing. And it really can be life-changing. And like in terms of the GLP, whatever, we talked to someone a couple of weeks ago about it, and it's not a bad way to kickstart your weight loss journey. It's maybe not the end all be all. It's not the answer for it, but there's nothing wrong with it. And if it can allow someone to feel less pain and to, like you just said, be able to complete her first triathlon with it, like how cool is that? Like what an amazing story. And you were able to help someone just live better and live healthier. So I think it's pretty awesome. So thank you for everything that you're doing.
Yes.
Anything else that you want to share with the listeners before we wrap up here?
No, we've talked mostly about women, and of course we see a lot of men with low hormones and the same thing, feeling unmotivated, sexual dysfunction, all those kind of things. So we see men as well, and have helped a lot of people just feel better. But yeah, especially with women, and how important, doing the resistance training. And if you're overweight and can hardly move, or it hurts to move, you're not going to want to go to the gym and try to lift these heavy weights in front of all these people. So I do agree, of course we want to start with healthy diet, exercise, but there are some people that just need a little bit more help. And even with the hormones, if you're not ready to start hormone replacement, there are certainly a lot of supplements that you can start taking that can kind of help boost those as well. So that's always a good place to start.
Well, thank you, JoAna. I feel like there's going to be some questions that come up for people, so we will definitely link your information below in the show notes. But other than that, you guys can always find us at 2dumbleblondes.com or on Instagram at 2dumbbellblondes. And again, thank you, JoAna. You are a wealth of knowledge, and there's so many different paths we could have gone
We
down.
might need to have you back on and go deeper down. I think this is going to be one where people listen to this episode several times, take notes, because there was a lot of information. And as we listen, we'll be like, well, what about that? What about that? So maybe we'll have to have a part 2.
Yeah, sure. Let me know.
All right. Thanks, guys. We'll see you next time.
Thank you.
Bye.
Bye-bye.